Constipation can be a really common thing with kids. It happens in like 30% of kids at some point in their life. And there's a bunch of different things that can cause it. Dehydration, poor nutrition, like lack of fiber, things like that. And there's a lot of things that we can do to help. So constipation is consistent of fewer than 3 bowel movements in a week, painful or hard stool, like really painful or hard to pass, very large diameter, like if your child is always clogging the toilet, that can be constipation. Another form of constipation is actually stool withholding. So if your child withholds stool as a behavior, as like a control mechanism, that can be considered constipation. And then if they're not completely evacuating and they sometimes are having like fecal incontinence, oftentimes that happens at night when they're fully relaxed laying in bed, that can be considered also constipation. So there's a lot of factors that go into this, like I was saying, behavior, dietary factors, different medical conditions, so like food intolerances, neurological disorders, things like that, and then also pelvic floor dysfunction. So in pediatric pelvic floor therapy, we work on making sure that the muscles are working together appropriately and that they're contracting and relaxing when they need to. We also work on toileting mechanics and toileting education, and it's all in a very age-appropriate way so that the child understands what we're talking about and they understand how to use the tools that we're giving them when they need to go to the bathroom. And we also make sure that we help the parents with how to kind of manage those behaviors and how to help their child as best as they can when they're using the bathroom. And again, it's all very age appropriate and child focused.